Today I will demonstrate you liver. Liver, it is largest gland in the body. It is endocrine as well as exocrine. It is located in the right upper quadrant of abdomen and it weighs about 1300 gram in females and around 1600 grams in females. Liver, it is somewhat reddish brown in color and it is also known as hepar in Greek language, from which we have adjectives like hepatic artery, hepatic vein and so on. Liver is soft and friable in consistency. Liver, it is located in the right hypochondriac region as well as in epigastric region and also extend into left hypochondriac region reaching into left lateral plane of the in the abdomen. Now external feature. Liver is somewhat wedge shape or pyramidal in shape. It is having 5 surfaces. These are anterior surface. This is right lateral surface. This is superior surface. This one is posterior surface and this is inferior surface. So these are 5 surfaces and there is a prominent inferior border. This prominent inferior border, this is sharp anteriorly and it separates liver, anterior surface of liver from inferior surface anteriorly and also separates right lateral surface from the inferior surface on the lateral side. So this is prominent inferior border. This inferior border is having 2 notches. One notch for the ligamentum teres. This is also known as interlobar notch and this is the cystic notch for the fundus of gallbladder. So these are 2 notches on the inferior border. Now liver here, though it is around 1.5 kg, here it do not sink in the pelvis on right side. It do not, because of gravity. Now the reason for this is the support of the liver. The support of the liver is that on the posterior aspect you can see here this is the groove. In this groove there is the inferior vena cava. So the hepatic veins which are entering in the inferior vena cava, this is one of the important support of this liver. Other supports, these are intra-abdominal pressure and the ligaments of the liver. However, they are less important. So main support is hepatic veins entering in the inferior vena cava. Now in anatomical position, this groove for inferior vena cava, it should be in posterior surface directed vertically upward. The right lateral surface should be on right side and this concave superior surface should be superiorly with prominent inferior border inferiorly. So this is the anatomical position of the liver. Now here coming to the lobes of the liver. Now this on this anterior surface you can see this is falciform ligament. So falciform ligament anteriorly and superiorly, then ligamentum teres inferiorly and ligamentum venosum posteriorly. These 3 ligaments divide this liver into 2 anatomical lobes. This is left lobe which is forming 1/6 of the total liver and this is right lobe which form 5/6 of the total liver. So these are 2 anatomical lobes, left lobe and right lobe. Now this anatomical right lobe, it contains these features, that is on posterior surface caudate lobe and on inferior surface quadrate lobe. As well as in between this caudate lobe and quadrate lobe there is fissure for porta hepatis. So these are the part of this right lobe, while this is the left lobe which is somewhat flattened and here it is having this tuber omentally here at the lower end of this ligamentum venosum. Now we will see the features of this caudate lobe and quadrate lobe. Now this caudate lobe, it is somewhat quadrangular in shape. Here the boundaries of caudate lobe, these are on right side. You can see here groove for inferior vena cava. On left side there is this ligamentum venosum which contains obliterated ductus venosum. On inferior aspect there is porta hepatis, and superiorly caudate lobe, it continues with the superior surface. So these are the boundaries of this caudate lobe. Caudate lobe on right and inferior aspect, it becomes continuous with the rest of the right lobe. This is known as caudate process of the caudate lobe. While on left side here, this is papillary process of the caudate lobe. Now coming to the porta hepatis. This porta hepatis, it is a fissure around 5 cm in length, and here this fissure, the margins of this fissure, it gives attachment to the lesser omentum. The content of this fissure, it is here you can see from before forward, these are the behind forward, this is the portal vein, then hepatic artery, and then the bile duct. So from behind forward, portal vein, hepatic artery and bile duct, that is VAD. However, the contents entering and exiting the porta hepatis, these are the hepatic artery and portal vein, they enter the porta hepatis, while bile duct and the lymphatics, they exit the porta hepatis. Some of the hepatic plexus of nerves, they also enter the porta hepatis. Now the quadrate lobe. Quadrate lobe, it is on inferior surface of the liver, and this quadrate lobe, it is bounded on left side by the ligamentum teres, on right side by fossa for gallbladder. Anteriorly, this is prominent inferior border, and posteriorly by the porta hepatis. So this is somewhat rectangular in shape, and these are the boundaries of this quadrate lobe, which is on inferior surface. Now coming to the functional lobes. Now we will see only the line separating this liver into two functional lobes, which are of surgical importance. Here, for functional lobes, the line anteriorly, it passes from the cystic notch to this groove for inferior vena cava. This is now Cantel's line, which is passing anteriorly from fossa for gallbladder to the inferior vena cava on this anterior surface. Then on the posterior surface, middle of the caudate lobe, and on inferior surface, it is passing from the fossa for gallbladder, floor of this fossa for gallbladder. So this Cantel's line, it separates liver into almost two equal right and left lobes. So this is functional classification of functional lobes, in which again the right lobe and left lobe, it is divided into right anterior and right posterior, and left lobe is divided into left medial and left lateral. Now coming to the relations of the liver. Liver, now as it is abdominal organ, it is covered by the peritoneum. So it is having two types of relations. One is peritoneal relations and one is visceral relations, that is with the other organs in the abdomen. Now peritoneal relation, liver is almost all over covered by the peritoneum except at certain places where it is not covered by peritoneum, and that is known as bare area of liver. So here the bare area of liver, we will enumerate it. That is, now here on the posterior surface, this triangular bare area bounded by superior coronary ligament and inferior coronary ligament inferiorly and right triangular ligament. So this is the bare area on posterior surface. Then here left triangular bare area on the left lobe. Then groove for inferior vena cava, it is again one of the bare area where peritoneum is absent. Then the fossa for gallbladder, it is one of the bare area. Then the margins of lesser omentum, that is, it also includes this porta hepatis and ligamentum venosum in between the two layers of ligamentum venosum, between two layers of ligamentum teres. Now coming to the visceral relations. Now visceral relations, here we will see the relations of each surface one by one. Anterior surface, here it is related with the anteriorly with the xiphoid process and the anterior abdominal wall, while on it is covered on each side here with the diaphragm. Diaphragm separates this anterior surface from the pleura and the lung. Now the right lateral surface, you can see impressions of the ribs on this surface. So here right lateral surface is covered by peritoneum. It is related with the 7th rib to 11th rib in the mid axillary line. This surface in its upper part, it is related with the diaphragm, pleura, lung and ribs. In the middle part, it is related with the diaphragm, costodiaphragmatic recess of pleura and ribs, while in the lower part, this surface is related with the diaphragm and ribs. Now the relations of the superior surface, which is somewhat quadrilateral. Superior surface on this side, it is related, these are the domes of the diaphragm, right and left. So here it is covered by the diaphragm. In the middle you can see concavity, this is cardiac impression, where it is related with the pericardium and the heart, separated by in between by the diaphragm. On each side, diaphragm separates the superior surface from lung and pleura. Now coming to the posterior surface. Now on the posterior surface, you can see this is bare area bounded by superior coronary layer and inferior coronary layer of the ligament, and here right triangular area. Then here there is groove for inferior vena cava, in the floor of which you can see the entry of these hepatic veins. Then there is caudate lobe. Then there is ligamentum venosum, and then on the left lobe you can see this is related with the esophagus. So these are the relations on posterior surface. Now coming to the inferior surface. Now on inferior surface you can see, starting from left side, this is impression on the inferior surface of left lobe, gastric impression. This gastric impression. Then there is ligamentum teres, which contain obliterated left umbilical vein. Then there is caudate lobe, on which there is impression for the pyloric part of the stomach and the first part of duodenum. Then here this is fossa for gallbladder. Then on the right side of this fossa for gallbladder, there are impression for the second part of duodenum, colic impression for hepatic flexure of colon and renal impression. Now one thing is left, that is near the groove for inferior vena cava, near on this bare area, there is impression for the right suprarenal gland. And here this is impression for the right kidney. So this is about the relations of the liver. Thank you.